Hello, my name is Brian, and today I'm going to be performing the central venous catheter removal. For this procedure, my patient's going to be John Doe. He was born September 18th, 1998. He has no allergies, and I'm just going to go ahead and begin with the skill. So for this skill, first things first, I want is a doctor's order. Once I get a doctor's order, I want to make sure my patient's baseline labs are okay. I'm looking for the hemoglobin, I'm looking for the hematocrit, I'm establishing the baseline in case he if he bleeds out throughout the procedure or something. Um, Make sure I know my platelets as well. Make sure his coagulation studies are within normal limits. I'm looking at his APTT, his PT and INR. Make sure they're not elevated because that can increase the risk of bleeding. And once I get my baseline labs done, I'm ready to go ahead and grab my equipment. It's going to be my central dressing tray, my suture removal, and occlusive dressing with an ointment, the antibiotic ointment. And before I begin, I'm going to go ahead and enter the room. Knock, knock. Hello, my name is Brian. I'm going to be your nurse for today, and today I'm just going to be removing your central venous catheter. And before I begin, hand hygiene. Can I verify your name and date of birth? I grab his armband or his arm. Can you tell me your name? His name is John Doe. And can you tell me your date of birth? September 18th, 1998. Okay, good. Once I finish establishing my two verification for the correct patient, I'm going to ask him, do you have any allergies? He says no. Great. And I'm going to explain to him about the procedure. I'm going to be telling him hey, so we're going to be removing the central venous catheter because we are done with your treatment of, long course antibiotics or, pressors. It depends. And the doctor wants to remove it because the more days you have this central venous catheter, it increases the risk of infection. So the sooner we get it out, the less likely you'll get an infection. Any questions why we're going to be removing it? He says no. Okay, great. So throughout this procedure, I'm going to be laying you in slight Trendelenburgs or supine, which means flat. You're going to be flat on your back throughout the procedure and roughly 1 to 6 hours after the procedure as well. And I'm going to be removing your catheter, and you're going to feel some slight pressure. It should not hurt. And also, you shouldn't be moving your extremity. You shouldn't be getting out of bed, and you shouldn't be lifting your head once we're done with the procedure and throughout the procedure. You're also going to be wearing a mask, and you're going to have to bear down when I'm pulling the catheter away from you, or I'm removing it from you. Do you know what bearing down is? The patient says yes. Okay. If he doesn't know, teach him. Okay, so basically bearing down means you're putting pressure, like you're going to the bathroom and you're just holding it. And that's it. And if the patient's on the ventilator, you want to remove the catheter during inspiration phase. And at the end of inspiration phase, or inspiratory phase. And any other questions, Mr. Doe? No? Okay, I'm ready to begin the procedure. For the procedure, I want to make sure nothing's connected to the central venous catheter, make sure everything's disconnected. I'm going to get his baseline extremity baseline to check for perfusion, neurovascular, to make sure it's intact. So I'm going to check if he could wiggle his toes, if he could move it, pedal pulses, pedal grade pulses. I'm going to establish a baseline for that. And establish a baseline for perfusion by touching the extremities on both sides to see if it's warm. So I'm comparing the pulse rates to both extremities, make sure he can move his toes, place him in supine. Once I finish establishing the baseline, I'm going to make sure he's on a cardiac monitor so I can monitor his ECG rhythm, check for any dysrhythmias, and I'm going to get some baseline vitals. Okay, great. So I'm going to go ahead and hand hygiene once again. Put on some gloves and remove this dressing. So there we go. So I already established hand hygiene and removed my hand hygiene, and I put on some gloves. So I'm going to go ahead and just remove this dressing. There we go. And now remove these gloves, hand hygiene once again. There we go. Oops. I put on the mask myself and open up my kit. Make sure everything's in camera. Alright, so everything's being opened up, everything's sterile. So to minimize my break of my sterile field, I'm going to cross over diagonally and just grab this sheet right here and establish my sterile field. Little 1-inch border. There we go. Again, minimize a break in sterility by going here in the corner, grabbing this. Minimize the break in sterility by grabbing here in the corner and giving my patient a mask. Make sure I don't cross my sterile field over here. Here you go, patient. John Doe, wear that for me. He wears it. And I'm just going to go ahead and hand hygiene once again, just to be triple safe. And at this part, hopefully, I'm going to move my camera, so I'm going to break sterile field so you can watch me put on my gloves. Okay, there we go. Okay, so everything's sterile. This is my sterile field. It's sterile inside here. Make sure I don't touch the 1-inch border. I can go ahead and start setting up my sterile field. The only thing I'm gonna need is honestly this right here and these. Okay, so sterile is good. I'm just going to go ahead, grab my chlorhexidine, make sure it's my chlorhexidine, break it open, and just clean my catheter, or his catheter. So I'm gonna move the camera again. There you go. So, make sure inner, outer, back and forth, 1, 2, 3, there you go. And this is my trash. And make sure it air dries for 2 minutes. Grab my suture removal kit. So grab up, clip, pull up, clip, pull up, clip, pull up, clip. There we go. I am all done with this. So alright, so next final thing is I'm going to tell my patient, alright Mr. Doe, are you ready? So you're going to bear down on the count of 3 like we previously mentioned, alright? So I'm going to pull it evenly and in gentle motion. On the count of 3, okay, 1, 2, 3, bear down, he's bearing down. If he's on the ventilator at the end of the inspiratory phase, pull it and apply pressure. And at the same time, I'm going to be looking at my catheter, this intravenous catheter, make sure it's intact. And it's, it has its integrity. I'm going to lift this up. Okay, so as I'm applying pressure, I'm making sure he's not, bleeding out. I'm making sure he's not shortness of breath in case, a piece of catheter dislodged and it's going to his heart. I'm making sure I'm looking at his vitals, making sure I'm looking at his cardiac monitor, and just making sure he's not moving his extremity. His extremity is strict and stiff. He's not getting out of bed. He's not elevating his head, and at least putting pressure for at least like 20 minutes, and making sure it's stopped bleeding. Once it's stopped bleeding, I'm gonna go ahead and just put some of this antibiotic ointment on him. And I'm going to be putting inclusive dressing. And I'm going to be labeling it daytime initial. Okay. Okay. And after all said is done, I'm going to be documenting the catheter length and the integrity, make sure it's not, the tip hasn't broken off. I'm going to be documenting his vitals every 15 minutes, twice. And then every 30 minutes, twice. I'm going to be documenting the patient's tolerance. And I'm going to be educating him. Okay, Mr. John, go ahead and just pull that call bell for me or press the call light in case your leg feels any warm wetness or pain or numbness, or if you're experiencing shortness of breath. I'm going to be making sure he just stays in this supine position at least an hour to 6. He's not bleeding. I established earlier his baseline extremity, neurovascular, perfusion, and motor and pulse grid. Making sure everything is, within baseline. Looking at his labs, make sure nothing's decreasing. Make sure looking at his vitals. He's not going hypotensive and tachycardic, which is like telltale signs of active bleeding. Other than that, I finished documenting what I was going to document, and the procedure, I want to say, is said and done. Also, actually, before I end off my procedure, I want to make sure I have an established 18 gauge IV access in case he does bleed out. I can have that in place already, so I could run some, a fluid bolus, or the doctor wants some blood products. So I want to make sure I have that as well. And if I don't have it, start one. And I think I'm done with my procedure. Everything's said and done. Thank you.